Have you ever wondered if the supplements you're taking to stay healthy might actually be doing more harm than good? That vitamin bottle sitting on your kitchen counter, the one your doctor recommended years ago, or that you picked up because the label promised better health and longevity, could it possibly be feeding something dangerous inside your body without you even knowing it? I've seen it too many times to count. Just last month I met Richard, a 72-year-old who had been diligently taking his daily vitamins for over 2 decades. He was doing everything right, or so he thought. After his routine checkup revealed an advanced tumor, he was devastated and confused. "How could this happen when I've been so careful with my health?" he asked me with tears in his eyes. The truth is, what we don't know about certain vitamins after age 65 could be silently undermining all our best efforts. Today, I'm going to reveal the 3 common vitamins that research shows may actually be feeding cancer cells in seniors, information that could literally save your life or the life of someone you love. And trust me, this isn't something most doctors will tell you during your 15-minute appointment. Stay with me until the end, because I'll also share exactly what you should be taking instead that can actually help protect your cells rather than potentially harm them. Hey there. Before we dive deeper into this crucial information, I'd love to know where you're watching from today. Drop your city or country in the comments below, and feel free to ask any questions that come to mind as we go through this together. This community has become such an incredible source of support for so many, and I'd be honored if you'd join us by hitting that subscribe button and turning on notifications. That way you'll never miss potentially life-saving information like what I'm about to share today. Let me start by addressing something important right away. The relationship between vitamins and cancer is complex, and not all supplementation is harmful. In fact, some nutrients are absolutely essential for preventing cellular damage. The problem is that as we age, especially after 65, our bodies process and utilize vitamins differently. What worked perfectly in your 40s or 50s might actually be creating problems now. Our metabolism changes, our kidney function often decreases, and our cellular repair mechanisms don't work as efficiently. This creates a perfect storm where certain vitamins in specific contexts might contribute to cancer development or progression rather than preventing it. The research on this topic has evolved significantly in recent years, and what I'm sharing today reflects the most current understanding we have about these interactions. Remember, this isn't about creating fear, but about empowering you with knowledge so you can make better decisions for your long-term health. The first vitamin we need to discuss is one that might surprise you, because it's often marketed specifically to seniors as an antioxidant powerhouse: high-dose vitamin E supplements. For decades, vitamin E was praised for its antioxidant properties and ability to fight free radicals. The conventional wisdom was simple: free radicals damage cells. Damaged cells can become cancerous, so antioxidants must prevent cancer. It seemed like perfect logic. But here's what happened when scientists actually tested this theory in large clinical trials. The SELECT trial, one of the largest cancer prevention studies ever conducted, followed over 35,000 men for years and found something alarming. Those taking vitamin E supplements had a 17% increased risk of prostate cancer compared to those taking a placebo. This wasn't a small study or a statistical fluke. It was a massive, well-designed trial that shocked the medical community. What's happening here is fascinating and concerning at the same time. In high doses, especially as we age, vitamin E appears to sometimes shift from being an antioxidant to becoming a pro-oxidant in the body. This means that instead of quenching those dangerous free radicals, it might actually be creating more of them in certain tissues. Additionally, some research suggests that high-dose vitamin E might protect not just healthy cells, but also early cancer cells that would otherwise be eliminated by the body's natural defenses. It's as if the vitamin doesn't discriminate between friend and foe, offering its protective shield to any cell, including those that should be destroyed. This doesn't mean all vitamin E is dangerous. The vitamin E found naturally in foods like nuts, seeds, and olive oil is generally beneficial and comes packaged with other nutrients that work synergistically. It's the isolated high-dose supplements, often containing 400 IU or more, that have been linked to potential problems. Most concerning is that many senior multivitamins and antioxidant formulas contain these high levels, and people take them year after year without ever questioning if they're still appropriate for their changing bodies. I'm going to take a quick pause here because I want to ask you something important. Have you or someone you love been taking high-dose vitamin supplements for years without reconsidering whether they're still the right choice? What health concerns keep you up at night when it comes to cancer prevention? You know, many people feel overwhelmed by all the conflicting health information out there, especially when it comes to supplements. It's exhausting trying to figure out what's actually good for you when it seems like the recommendations change every few years. I completely understand that frustration. This is a safe space to share your experiences or concerns. Simply copy the phrase, "My biggest concern about supplements is," and tell us what's on your mind. Your comment might help someone else who's feeling just as confused or worried, but hasn't found the words to express it. Plus, your insights help me create more relevant content that addresses the real questions and concerns you're facing. Remember, you're not alone in this journey, and sometimes just knowing others are navigating the same challenges can bring enormous comfort. Let's continue with our second vitamin that warrants caution after age 65, vitamin A in the form of preformed retinol or high-dose beta-carotene supplements. Vitamin A is essential for vision, immune function, and cell growth. No one disputes its importance. However, what many people don't realize is that vitamin A accumulates in the body, particularly in the liver, and older adults are more susceptible to reaching toxic levels. Several major studies have found alarming connections between supplemental vitamin A and cancer risk. The CARET study, beta-carotene and retinol efficacy trial, was actually stopped early when researchers discovered that participants taking beta-carotene and vitamin A had a 28% higher risk of lung cancer and a 17% higher risk of death compared to those taking a placebo. This was most pronounced in current and former smokers, which includes many people currently in their 60s, 70s, and 80s who smoked earlier in life when it was more socially acceptable. What makes this particularly tricky is that many people don't even realize they're taking high doses of vitamin A. It's in your multivitamin, but it's also added to many fortified foods like cereals and meal replacement shakes that are marketed to seniors. This creates a situation where you might be getting far more than you realize. The mechanism behind this increased cancer risk is multifaceted, but research points to a few key factors. In higher concentrations, vitamin A derivatives can actually promote inflammation in certain tissues. They may also interfere with vitamin D function, which is crucial for cancer protection. Additionally, some studies suggest that excess vitamin A may impair the function of natural killer cells, which are important immune cells that help identify and destroy cancer cells before they can form tumors. This is especially problematic for seniors because natural killer cell function already declines with age. It's important to note that getting vitamin A from colorful fruits and vegetables is still highly beneficial. The beta-carotene in foods like carrots, sweet potatoes, and dark leafy greens is converted to vitamin A only as the body needs it, creating a natural safety mechanism that prevents toxicity. It's the preformed vitamin A, usually listed as retinol palmitate or retinol acetate on supplement labels, and isolated beta-carotene supplements that require caution. Our third vitamin of concern is one that's been heavily promoted for seniors due to its critical role in neurological health and energy production, vitamin B12. Now, to be absolutely clear, B12 deficiency is a serious concern for many older adults. As we age, our ability to absorb this vitamin naturally from food decreases significantly. Up to 30% of people over 65 have some degree of atrophic gastritis, which reduces stomach acid production and makes B12 absorption difficult. So why am I including it on this list? The issue isn't with addressing a deficiency, which is necessary and beneficial. The concern lies with the excessive supplementation that has become increasingly common, particularly with sublingual or injectable forms that bypass the body's natural absorption controls. Some seniors are taking 5,000 mcg or more daily, which is over 2,000 times the RDA, thinking more must be better. Recent research has raised questions about extremely high B12 levels and cancer relationships. A study published in the Journal of the National Cancer Institute analyzed data from over 77,000 participants and found that those with the highest B12 levels had a 40% increased risk of lung cancer compared to those with the lowest levels. Other studies have found associations between elevated B12 and increased Risk of colorectal, pancreatic, and prostate cancers. The proposed mechanisms are still being investigated, but one theory involves B12's role in DNA synthesis and cell division. While adequate B12 is absolutely necessary for healthy cell function, excessive amounts might theoretically support more rapid division of not just healthy cells, but also precancerous ones. Another hypothesis involves the interaction between high B12 levels and folate metabolism, which might affect how genes are expressed, potentially activating oncogenes, cancer-promoting genes, or deactivating tumor suppressor genes. What makes this particularly concerning is that many seniors get regular B12 injections or take high-dose supplements without any testing to confirm they actually need that much. Their doctors may have prescribed supplementation years ago when guidelines were different, and no one has reassessed whether the current dose is still appropriate. Some people continue these high doses for decades without monitoring. What's even more concerning is how these three vitamins might interact with each other and with medications commonly prescribed to seniors. For example, many people over 65 take statins for cholesterol management. Statins can deplete CoQ10 levels, leading some people to take additional antioxidant supplements like vitamin E to compensate. This creates a situation where someone might be taking high-dose vitamin E while already having other risk factors we've discussed. Similarly, proton pump inhibitors for acid reflux, which are used by millions of seniors, can reduce B12 absorption from food. This often leads to B12 supplementation, which is necessary, but sometimes at doses far higher than required to correct the deficiency. What I'm suggesting isn't that you should avoid these vitamins entirely, but rather that you need a more nuanced, personalized approach as you age. The one-size-fits-all multivitamin you've taken for years may not be the right choice anymore. Your nutritional needs at 45 are different from your needs at 65, 75, or 85. Your body's ability to process and utilize these nutrients changes, and your supplement regimen should reflect that. So what should you do instead? First and foremost, work with healthcare providers who understand the unique nutritional needs of older adults and who stay current with research. A functional medicine doctor, a geriatrician, or a registered dietitian specializing in senior nutrition can be invaluable. Second, get appropriate testing before taking high-dose supplements. A comprehensive blood panel can identify actual deficiencies rather than just assuming you need more of everything. For vitamin B12, methylmalonic acid testing provides a more accurate picture of your functional B12 status than standard B12 blood tests. For vitamin A retinol test can determine if you're already at levels that don't require additional supplementation. Third, focus on getting these nutrients from food whenever possible. The vitamin E in almonds and olive oil, the beta-carotene in sweet potatoes and spinach, the B12 in fish and poultry all come with cofactors that help your body utilize them properly. They also come in natural doses that are less likely to create the problems we see with concentrated supplements. Fourth, if you do need to supplement, consider forms that are better suited to older adults. For vitamin E, mixed tocopherols at lower doses, under 100 IU, are generally considered safer than high-dose alpha-tocopherol alone. For vitamin A, emphasize food sources of beta-carotene rather than pre-formed vitamin A, retinol palmitate, in supplements. For B12, methylcobalamin at appropriate doses based on your tested levels is typically the better choice over high-dose cyanocobalamin. Here's another critical point that doesn't get enough attention. Cancer development isn't usually about just one factor. It's about the accumulation of multiple risk factors and missed protective opportunities. Taking potentially problematic supplements is just one piece of the puzzle. Equally important is ensuring you're getting enough of the nutrients that have been shown to have protective effects. Vitamin D is particularly important here. Many studies have shown associations between adequate vitamin D levels and reduced risk of multiple cancer types, including breast, colorectal, and prostate cancers. Yet vitamin D deficiency is extremely common in seniors, affecting up to 70% of older adults by some estimates. Similarly, adequate levels of certain minerals like selenium and zinc play important roles in DNA repair and immune function, both crucial for cancer prevention. Many seniors are deficient in these minerals while simultaneously taking excess amounts of the vitamins we've discussed today. It's this imbalance that creates much of the risk. There's also compelling evidence that certain plant compounds have significant anti-cancer properties. Compounds like sulforaphane from cruciferous vegetables, curcumin from turmeric, and EGCG from green tea have all shown promise in both laboratory and human studies. Yet many seniors focus on their vitamin pills while consuming a diet that's largely devoid of these powerful protective compounds. I want to emphasize that I'm not anti-supplement. Appropriate supplementation can be life-changing and even life-saving in many circumstances. What I'm advocating for is thoughtful, personalized, evidence-based supplementation rather than the casual one-size-fits-all approach that's been common for decades. The science of nutrition and aging is evolving rapidly, and our approach to supplementation needs to evolve with it. Let me share a quick success story that illustrates what a more personalized approach can look like. One of my viewers, Barbara, was 68 when she first came across information similar to what I'm sharing today. She had been taking a senior multivitamin with high levels of preformed vitamin A and vitamin E, plus a separate B complex that contained 1000 mcg of B12, all on top of a diet that already included fortified foods. After learning about the potential risks, she worked with a healthcare provider to test her actual levels. The results showed she was already at the upper end of the normal range for vitamin A, had more than adequate vitamin E, and had B12 levels well above what was needed for optimal health. She switched to a lower-dose multivitamin that contained mixed tocopherols rather than just alpha-tocopherol for vitamin E, eliminated the separate B complex, and focused on getting more nutrients from whole foods. 6 months later, her follow-up testing showed more balanced nutrient levels, and she reported having more energy and fewer headaches than before. Her inflammatory markers, which had been slightly elevated, returned to the normal range. This brings me to another important point. How do you know if your current supplement regimen might be causing problems? While there's no definitive way to determine if vitamins are contributing to cancer risk in an individual, there are some signs that your supplementation might need reconsideration. These include unexplained fatigue, headaches, or joint pain that started after beginning supplements, skin changes like unusual dryness or yellowing, which can indicate vitamin A excess, nausea or digestive issues that occur after taking your vitamins, and any new or unusual symptoms that coincide with changes in your supplement routine. If you experience any of these, it's worth discussing with your healthcare provider. Additionally, certain medical conditions make it more likely that high-dose supplementation could cause problems. These include liver or kidney disease, which affect how vitamins are processed and excreted, a history of smoking, which interacts with certain vitamins to potentially increase cancer risk, and a personal or family history of hormone-sensitive cancers, which might be influenced by certain nutrients. It's also worth noting that the timing of supplementation may matter. Some research suggests that taking antioxidant supplements during cancer treatment might actually protect cancer cells from the oxidative damage that many treatments are designed to cause. This doesn't mean antioxidants from foods are problematic during cancer treatment, but high-dose isolated antioxidants in supplement form might be. If you're currently undergoing cancer treatment, it's essential to discuss all supplements with your oncology team. Similarly, the quality of supplements varies enormously. The FDA doesn't regulate supplements the same way it regulates medications, which means there's less oversight regarding what's actually in that bottle you're purchasing. Independent testing has found that many supplements don't contain the amounts of ingredients listed on their labels, and some contain harmful contaminants. Choosing supplements that have been tested by independent organizations like USP, NSF, or Consumer Lab provides some assurance that you're getting what you're paying for without dangerous additives. Let's address another common question. If these vitamins might be problematic, why do doctors still recommend them? There are several reasons. First, medical training typically includes very little nutrition education, and what is taught often doesn't include the latest research on supplements and aging. Many doctors are working from information they learned years or even decades ago. Second, the standard medical appointment doesn't allow much time for nuanced discussions about supplements. It's easier to recommend a standard multivitamin than to create a personalized supplementation plan. Third, the evidence on vitamin risks is still evolving and sometimes contradictory. Some studies show harm, others don't, making it difficult to form definitive recommendations. What we do know is that the potential for harm increases with age and with higher doses taken over longer periods. This is why a personalized approach based on your specific situation is so important. I want to be clear about something. The goal here isn't to create fear or anxiety about every supplement you're taking. The goal is to empower you with information so you can make more informed choices. For most people, the best approach is moderation, periodic reassessment, and a focus on nutrients from food whenever possible. If you're currently taking high doses of any of the vitamins we've discussed today, don't panic. Instead, use this as an opportunity to reassess your supplementation strategy with qualified healthcare providers. Bring the information we've discussed to your next appointment and ask for appropriate testing to determine your actual nutrient status. Consider whether lower doses or different forms might be more appropriate for your current age and health status. And most importantly, look at your supplement regimen as something that should evolve as you age, not as something set in stone. I've covered a lot of information today, so let me summarize the key points. After age 65, 3 common vitamins that warrant caution are high-dose vitamin E, particularly alpha-tocopherol above 400 IU, preformed vitamin A and isolated beta-carotene supplements, and excessive vitamin B12 supplementation beyond what's needed to correct a deficiency. These nutrients are essential for health, but the supplemental forms and doses commonly taken by seniors may, in some circumstances, contribute to cancer risk rather than reducing it. The better approach is personalized supplementation based on testing, with an emphasis on food sources of nutrients whenever possible, appropriate doses and forms when supplements are needed, and regular reassessment as you age. Additionally, ensuring adequate levels of protective nutrients like vitamin D and beneficial plant compounds is just as important as avoiding potentially problematic ones. Thank you so much for staying with me through this important information. If you found this valuable, please hit that like button and share this video with someone who might benefit from it. The greatest gift we can give our loved ones is knowledge that might protect their health. I'd be honored if you'd subscribe to our channel for more evidence-based information on health and wellness for seniors. Remember, you have more control over your health than you might think, and small, informed changes can make a significant difference in your well-being and longevity. Stay curious, stay informed, and never stop advocating for your own best health. Until next time, this is a journey we're all on together, and I'm grateful to be walking it with you.